as Tara said, generally takes about a day or two for that recording to finish up, and we'll get a copy of that out to you, as well as a copy of the slides. So while I kind of get going here, I'll let you read the disclaimers. We don't send things to the FDA prior. Hope everyone had a fantastic Valentine's Day yesterday, which is really on course for talking about the heart today. So first, I want to take a moment and just kind of address really the Revelation family of pharmacies, which more and more get added to this every single month. So since our last webinar, we did have 2 more come into the family. So really, it's independent compounding pharmacies across the United States kind of coming under one umbrella. So really, we can use economies of scale. So as we're going through and talking today, you may have one of the locations close to you, or you may not, and that's fine. We can ship all over the country. So both whether it's from a compounding pharmaceutical perspective or with nutritionals, as well as with our consultation services, we do those via Zoom as well as WebEx. So, or a phone call if you just want to do it the old-fashioned way, that's fine too. We're easy to get along with. So with that being said, really kind of what we do, specialized in compounding pharmacy. So that is taking the art of pharmacy with the technology of today, and it's really the blending of 2 or more ingredients to form that final product. So whether it's from compounded bioidentical hormone replacement therapy to injectables, nasal sprays, suppositories, treats for your dog or kitty cat, really everything in between. Also specializing in natural medicine, and that's going to be our focus today. What can we do naturally? What can we do herbally to help support heart health? We do offer personalized consultations, and as we continue to add more pharmacies to the network, we'll have continue to add additional consultants to that, trained in functional medicine and integrative approaches. And we also offer a whole host of different testing. So whether that's salivary, urine, blood, stool, and you can go right to our website and click on that if you're having a hard time getting different blood work ordered, and we can help facilitate that for you. So with that being said, we'll kind of start with some deep thoughts. So in the beginning, disease is difficult to recognize, but easy to cure. In the end, disease is easy to recognize, but difficult to cure. So that goes back to the 1700s with Mesmer, kind of that Chinese proverb, right? An ounce of prevention is worth a pound of cure. That's really where this came from. And so with functional medicine, that's what we try to do. How can we catch something really before it happens? How can we shift things around? So I want to start easy, right? And so folks are always coming to me and say, Baylor, what can I take? X amount old, I'm relatively healthy. What can I do to continue being healthy? And I can't emphasize this enough. And I know for those of you that have seen me before, you're saying, well, Baylor, I've heard you talk about this before. Absolutely. And you're going to hear me talk about it on the next one and the next one and the next one, because that's how important this is. So it's like building a house. We need that foundation solid. So we use our phytonutrient multi, which is a food-based multi with methylated B vitamins. Methylation, I'm going to do an aside on this now. So half the population has what's called an MTHR deficiency. So it's a genetic SNP in our helix where we're not able to metabolize and convert folic acid and B12 properly. In this demographic of the population, we see an increase in number one, cardiovascular disease, which is what we're talking about today. And then we also see an increase with neurological disease as well as psychological things too. So it does affect the whole neurotransmitter cascade. So I put everyone on methylated Bs. I hedge my bet. So typically that's going to be 1 to 2 tablets a day. Do take it with some food. Bees will upset the stomach if you take it on an empty stomach, and it is going to turn your urine like a Mountain Dew color like that. We're not killing you. We're not overdosing you. I promise. It's biochemistry happening at its finest. If you have a hard time swallowing tablets, we do also have this in a capsule version as well. With capsules, then it does take 3 capsules to equal 2 tablets. With tablets, you can compress more into a smaller area. Next up, fish oils, our pure omega 1000 fish oils, omega-3 essential fatty acids. For a baseline, I do 2 a day for folks. If it's, well, I'm trying to lose weight, or I have high cholesterol, I've got blood sugar issues, the list goes on, I've got, depression, whatever, then I'm going to increase that up to 3 or 4 a day. If you can't swallow the soft gels, we do have a liquid that's available that 1 teaspoon gives you 2,400 milligrams of EPA and DHA. This is critical. There's a lot of different fish oils out on the marketplace, and a lot of people kind of will do a relative potency versus fish oils, right? We call our pure omega 1000 because it's 1,000 of EPA and DHA. It actually has about 1,800 milligrams of fish oil, but the active chemical constituent is looking at the EPA and DHA content. And that's what's so very critical for disease states and health. So that's what we want to push. So our fish oil as a liquid, and I've got a picture of that in just a moment. And you may be thinking, oh, Lord, Baylor, that's going to taste awful. Absolutely not. It is extremely clean. Does it have a slight taste of fish? Very, very, very slight. Keep it in the refrigerator. It almost totally nullifies that out, but very clean. If you're doing a smoothie or something, add it to the smoothie. You won't even know it's in there. So 1 teaspoon equals 2,400 milligrams of EPA and DHA. So baseline, a teaspoon a day. If you've got heart issues, cholesterol, trying to lose weight, blood sugar issues, then I'm going to increase that to 2 teaspoons a day. Vitamin D3. The majority of our patients we see are deficient in vitamin D. Low vitamin D affects inflammation, mood, bone density. The list goes on. Immune function. Right? So as a baseline, I'm going to do 1 a day. If we have labs and your level is low, then I'm going to go higher with that. Now, for labs, for instance, the normal is 30 to 100. Optimal, though, is getting that number between 60 to 80. Okay, so you may be at 32 and your practitioner may say, hey, you're within normal range. Within normal range and optimal function are 2 different stories. For me, I go like a banshee. My bar is high. I want to go until I just drop dead and be gone. So I'm working for you the same way that I do for myself. Optimal health, I want your bar high until the end. Okay. So we're going to go towards this upper side. If you have autoimmune disease, I'm going to hit more 80 versus 60. Why? Because of the immune and the anti-inflammatory impact. The other thing in the arsenal of baseline is CBD. Our Boxley's organic. It is one of the few lines that is certified organic, very clean, 10 pages of data for every lot and batch. And I'm going to go more in depth on CBD because I feel it's that important. Inflammation, right? And you're going to hear me inflammation over and over today. Why? What's the root behind cardiovascular disease? Inflammation. Okay, so that's why it's so very important. Really kind of a minimum of 15 milligrams a day of cannabinoids, and I'll crank that up. I'll go well above 100 for some patients. Most of my patients are between that kind of 30 to 50 milligram piece. Obesity and being overweight are the most common nutritional disorders in the United States, affecting the majority of adults in the country. Through the years, they have to keep reclassifying obesity and adding other aspects. Originally, it was just you're obese or you're not obese. Then it's you're severely obese or you're obese or you're not obese. And then morbidly obese and then majorly morbidly obese. They keep moving that bar out. We keep getting fatter and fatter. And so they're having to keep redoing what's the higher level of that. Persons with high health risks had twice the cumulative disability of those with low health risks. Not only do persons with better health habits survive longer, but in such persons, disability is postponed and compressed into fewer years at the end of life. And that's where this slide comes in, right? And so earlier I mentioned, I like keeping my bar. I want to go, and even if no matter what I do between now and my end point is the same, even if no matter what I do, I die at 80. I want that bar high and then just drop dead and be gone. I don't want to be in a diaper the last 5 years at the end of my life and having my kids have to take care of me. And, you know, my wife and I are always betting on which kid that's going to be taking care of us. But anyway, you can look to see where that kind of breaks off. It's not 50, folks. It's actually 35 and it's downhill, right? So we want to try to keep this bar up as high as we can, as long as we can. So incidence of lifestyle-related illnesses it increases with age. So cardiovascular disease, #1 killer for men and women in the United States. Now, granted, during COVID, we had a little blip in time where that overshadowed that piece. But otherwise, in normal times, cardiovascular disease is the #1 killer. Diabetes, 1 in 5 over 65. Metabolic syndrome, 22% of adults. It's almost 1 in 4. That number you can see increases as you age. Now, you may be thinking, well, what is metabolic syndrome? There's a number of different things that kind of go along with that. And it's having a certain number. So part of that is increased waist-hip ratio, increased cholesterol, increased blood sugar, right? So as you go kind of check, then that's your body's in metabolic disarray, which is increasing your risk factors for when you age. So relationship of BMI. So BMI is really that body mass index. So as you can see, as your BMI increases, that risk of mortality increases. Let me make this black and white for you. Carry more fat, you're going to die sooner. Plain and simple. It's as simple as that. If you want to die sooner, be fatter. Easy. Okay. So I take 5 pounds as serious for folks as I do with 50 or 100 or 150 pounds you need to lose. Even that extra 5 pounds, we're going to feel it. We're going to be more sluggish and have more aches and pains. Fat equals inflammation. Okay. So we need to pull that fat off. And I'm being very specific with saying fat. We don't want to lose muscle mass. We don't want to lose bones. We don't want to lose organ. We want to lose fat mass. So, you know, we really need to think about what we're eating, what's going into our body, how we're metabolizing things. And I don't expect you to be able to read this slide. Really, the point of this slide is, you know, unhealthy versus healthy, right? Unhealthy, you're affecting that cardiovascular system. You're affecting the endothelium of the cardiovascular system. You're carrying more of that body fat around. We need to decrease that. We need to eat healthier. We need to make better choices on our food, and that is on a daily basis. So real foods, whole foods, unprocessed, right? Stop the ultra-processed foods. They affect immunity, increase inflammation, decreasing the sugar, the starch. They are also suppressing immunity, increasing inflammation, and worsening viral loads. Limiting or stopping the alcohol. Also, immune, inflammation, and as well, alcohol is depleting key nutrients in the body. Our water, we want to make sure, basically take half your body weight. So if you're 150 pounds, drink half that, 75 ounces of water a day. Now, that may go up, that may go down, depending on, you know, do you have a renal issue, kidney issue, or, you know, are you an athlete? Is it summertime? Certainly summertime, exercising out in the heat and humidity. Well, then, yeah, we're going to push that up a little bit. Okay. So these are some basic things that we can do. If you're like, well, I need help with that, give us a call. We can do a consultation, work with you, and really teach you. Our aspect is, you know, goes back to simplicity, right? Instead of giving you a fish for the day, we try to teach you how to fish. Okay. We try to teach you how to do it on your own versus making you dependent on us. And we go lots of different, some people say, what about keto? What about paleo? What about this or that? My baseline is the Mediterranean style diet. From there, we may skew to keto. We may go to paleo. We may go to an HCG type diet for an extreme diet. We may go to a modified elimination diet, a detox diet, anti-inflammatory diet. Again, depending what your personal situation is, we're going to look at what we need to do based on what information is presented in front of us. Additional lifestyle changes, certainly aerobic, cardio. Now, I got to tell you, this changed about 8 months ago. Up until then, to helping to prevent metabolic syndrome, and everything I've talked about so far is going to help against metabolic syndrome. So, that increased blood pressure, increased cholesterol, increased blood sugar, increased waist, hip ratio, so increased fat mass. It was 150 minutes a week. Guess what? They increased it to 300 minutes a week. They realized, oh, shoot, actually, we need more exercise. Personally, I think part of that goes to, look at what's happened the last 3 years with the increase of Zoom and everything else. People are working more remote, being more sedentary, not walking around at the office and, walk into their car and even go into the office for that matter, right? So we need to make sure we're getting the heart rate elevated 300 minutes. I want you sweating. Okay. If you're not doing anything now, don't just start 300 minutes next week. Work up to it. Start with 5 minutes a day. And then as you're feeling better, go to 7.5, go to 10, 15, 20. It's okay to slowly escalate that. Do it in little chunks that are achievable, and you can check off, go, wow, all right, man, I feel good about myself. I'm able to do that and accomplish that. From a bone density perspective, we want to pull some weight bearing on board at least 2 days a week to 3 days a week. Daily stretching, especially as we get older, we need to stay limber and loose, right? So we don't fall and affect our bones and hurt ourselves. Sleep, 8 hours of straight sleep. I can't stress that enough. How many patients do I see a week that, yeah, I'm getting 8 hours, but oh yeah, you know what? I wake up 3 or 4 times a night. No, that's not straight sleep. You're disrupting your circadian rhythm. You're affecting delta wave sleep. You're affecting the restorative sleep, which is having a negative impact on your adrenal glands, which is having an impact on your health. Relax, breathe deep, do it often. Okay, do that belly breathing. So some things I use to help with weight loss are plant protein shakes. Bring in 21 grams of protein with less than 1 gram of sugars and and about 8 grams of carbs per shake. Great amino acid profile. Anybody that deals with me knows, and deals with our sister pharmacies know, we're very picky about the lines we carry. Right? We deal with companies that do dissolution, disintegration, mass spectroscopy, liquid chromatography. So it is exactly what's listed on the label, and it doesn't have the junk in it. So I'll use these, help them with weight loss, blood pressure, cholesterol, metabolic syndrome, or just as a meal replacement. Now, are these also safe? My son is a D1 athlete. His favorite protein shake is our protein shake. Absolutely. And he's even given free stuff by the trainers there at the university. So he feels better on it, gets better outcomes, and of course, taste is fantastic. So typically with most of ours, I know I've got chocolate up on both of these right here. You can guess which one I gravitate towards. I get my chocolate fix that way, but we also have vanilla and we also have some unflavored. So lots of choices. But these are just a couple to give you an idea. So typically I'm going to bring in the Mediterranean style diet, use a protein shake, helping to bring in extra branched chain amino acids, helping to build that muscle, helping to decrease the fat mass. And then of course, having the fish oils on board, right? And here's a picture of our Pure Omega 2400. I promised you I'd show you. So why, Baylor, why are fish oils so important, especially when we think about it from a weight loss perspective? Well, if you look at the cell wall membrane, okay, you've got a cell, you've got the nucleus of the cell, which is like the brains of the cell. You've got the mitochondria, which is the engine to the cell. So you eat food, food gets turned into the usable sugar, glucose, right? So then your body secretes needs insulin. So insulin has to come, and insulin serves as channels to get that glucose in. Well, what happens if that cell wall is stiff and rigid? Boom, boom, it's bouncing off. What is that? Insulin resistance, if you've heard of that. How many of you are taking a drug called metformin, helping against insulin resistance? You don't have a metformin deficiency. You've got a permeability of the cell wall membrane as part of the issue. Now, granted, there can be lots of different issues with that, but we need to work on that permeability of the cell wall membrane. The more permeable we make this, the more pliable, the flexible, the easier it is for that insulin to come in, serve as channels, get the glucose in, send signals to the nucleus, send signals to the mitochondria. Bam, we get burning out of the cell. Folks, this is physics 101 at its easiest and best. Energy in equals energy out, right? We're like a high performance sports car. We got to treat ourselves that way. All right, you're not going to put crappy fuel into a Ferrari. You're going to spend that little bit and put 93 octane or whatever. You want to get peak performance. You're going to put a good set of tires on that car so you get good traction and not just buy the cheapest tires you can. You're going to be slipping and sliding all over the road. Now, I was just at a functional medicine conference this past weekend down in Orlando. And it was kind of funny because I've been doing this a long time. I've been doing this almost 30 years now. So doing really functional medicine stuff before it even got termed functional medicine. And it's funny. What are we talking about? What were some big topics of discussion again? Fish oils, methylation, fat, right? Over and over and over, years and years and years. And this is still topic today. Can't stress it enough. But also good for everything head to toe. I can give you data on fish oils being clinically as effective as Prozac for mild depression. High levels, very high levels, about 8,600 milligrams. I'll use it for schizophrenia, bipolar. So yes, it does help with brain function. Getting that DHEA high, my kids with dyslexia, it's going to help one side of the brain talking to the other. That's why it's so very vital. So let's talk about just some other kind of quick, down and dirty. What are some of my favorite other things I go to for a variety of things? And then we're going to get talking about nitric oxide a little bit and come back and finish the day with CBD. So magnesium deficiency. Well, guess what? 75% of the population is deficient in magnesium. Patients in pain, that number goes to 95%. That's huge. So you can see by now, you've probably already read some of these things that it helps with, right? Headaches. One of the first things I start folks on with chronic constant migraines, cramps, muscles. Guess what's a very important muscle of the body? Cardiac, right? Helps with arrhythmias, cramps, etc. Magnesium, magnesium, magnesium. Now, there's a lot of different chemical forms of magnesium, okay? And I'll get into that in a minute, but magnesium glycinate is my favorite. It's a cofactor. Magnesium is a cofactor in more than 300 enzymatic pathways in the human body. Protein synthesis, muscle and nerve function, blood glucose, blood pressure, right? These are the two big things, and also dealing with protein with metabolic syndrome, okay? Oxidative stress, glycolysis, helping with our DNA, active transport of magnesium. So Baylor, I've got osteopenia or osteoporosis. Guess what? I generally am going to do a 2-to-1 ratio of calcium to magnesium, okay? We need magnesium on board. Typically baseline, for most folks, I'm going to go for is about 400 milligrams a day of the glycinate molecule. So here it is right here. So our magnesium glycinate, 3 capsules are going to yield 400 milligrams. Okay. Now you'll notice over here, I have 1 to 5 capsules. Why? I'm used to dealing with patients that are extremely sensitive. It's okay if you're not doing it, start with 1. Do 1 for a few nights. If that's okay, go to 2, then go to 3, then go to 4. And if you go to 4 and you're like, oh, wait a second, my bowels are getting a little loose. decrease the dose, back it back down. Okay. If you've got pain, fibromyalgia, that type of thing, I mean, that's where you're going to kind of be at more kind of that 3 to 5 zone. Okay. So certainly increasing that dose up is tolerated. If it's, and you'll notice we're very aware of gluten, dairy, vegetarian, etc. We try to make as clean products as we possibly can and have made for us. But if it's Baylor, I can't swallow. All right, guess what? We got you covered. We got a great tasting. It's a lemonade flavored chewable magnesium that does a fantastic job. We also have magnesium as a powder. Now, the best time to dose, especially magnesium glycinate, you're going to love this, is at bedtime. Why? Because the glycine molecule with the magnesium does a great job of relaxation. So let's get a 2-for-1er. Do it at bedtime. A lot of times you add it at bedtime, it's going to help with sleep, and you don't need to take that if you're going for that Tylenol PM or Benadryl, whatnot. You don't want to be taking that stuff anyway every night for the liver impact or the brain impact that long-term Benadryl use, diphenhydramine use can cause. So dose it at night, you'll get a 2-for-1er and can help with sleep as well as help with the heart and all those enzymatic pathways in the human body. Methylation support. I mentioned methylation just a little bit earlier with regards to it's built into our multivitamin. It's built into our phytonutrient multi. But for some patients, we need to bust that, bring that up higher, or if it's, well, Baylor, I've been sensitive to multis in the past. Let's just isolate out and start with just the methylated Bs. Absolutely, we've got that covered for you. What you're going to notice is that is going to help lower that homocysteine level. So homocysteine is a blood test that is indicative of cardiovascular inflammation. It's going to help with the fatty acid, nucleic acid synthesis, energy production, nerve metabolism, cell maturation, and helping with the GI health overall. Tons of different things. So I love methylation support. Again, do take it with food, and it is going to turn the urine a bright yellowy green very, very quickly. Okay. It's funny. I put my father-in-law on it once. He calls me and, he's an old, I was going to say ex-Marine, but, he'll say always a Marine, once a Marine, always a Marine, right? He goes, what in the heck are you doing to me, man? I've got nuclear pee. So yeah, it happens fast. Coenzyme Q10, for the vast majority of patients, I don't think always and never generally don't exist in my vocabulary for medicine, but this is about as close to always as you're going to get. So if you were to ask me, Baylor, if you've only got a choice for one antioxidant, what antioxidant is that going to be? 99% of the time, I'm going to give you the answer of coenzyme Q10. Okay. You can find it in some dietary sources. The richest is going to be meat, fish, nuts, some oils. It's much lower in dairy and veggies and fruits and cereals. Certainly depending on the origin of the food, the nutrient density of the soil. But to give you an idea, 30 milligrams of CoQ10 from food sources, to get 30 milligrams, it's going to take a pound of sardines or 2 pounds of beef or a half a pound of peanuts to equal that 30 milligrams. That's a lot of food. What was I already speaking about? We are an overweight society. The nutrient depletion in the soil is so great. That's why we're not able to get things in our soil like we should be able to. So that's where supplementation comes in. And so in general, dietary intake for most people is really accounting for only about 3 to 5 milligrams of CoQ10 per day. So it's not enough to get us to where we want. That's where we need to pull in supplementation and get that up. And certainly our endogenous, not only production and richest muscle in the body, by the way, of CoQ10 is cardiac, right? And then we also see for brain. Age, right? Increased tissue demands and medication-induced deficiencies. So that's really why we're seeing this insufficiency able to meet the requirement. So as we age, we need more. And then as they kind of stack on more and more medications, generally, we're going to kind of need to counterbalance that. The big one that depletes coenzyme Q10 are your statin drugs. If you are on a statin drug, you have to be on coenzyme Q10. Why? Let me go back to my cell picture, right? Nucleus, mitochondria, richest piece, CoQ10 right here in the mitochondria. So you're taking a statin drug to lower cholesterol, but you're also depleting the primary nutrient for mitochondrial function. CoQ10 is that energy source for the mitochondria. And that's also why when you go on a statin, you'll see brain fog, aches and pains, fatigue, lethargy. You've depleted your CoQ10. Here's a chart showing you how it is depleting as you're aging with heart and the lungs and the kidney, as well as liver, what it was as you age. So, as you get going, you got 42% of what you had in the cardiac. Let's see what I want to pull out of this one. Energy transport, I think I've already kind of gone over that without the mitochondria. Study, this is interesting. There was a heart health study, CoSymbio study back in 2013. It was a randomized double placebo-controlled study with 420 patients, giving 100 milligrams 3 times a day or placebo. Within the 3 months, CoQ10 supplemented subjects had a reduction in the probrain, the NT peptide, which is a marker of heart health. After 2 years, patients who were supplemented with CoQ10 had significant cardiovascular improvement overall compared to placebo. That's really pretty huge. To kind of break out some of the stats further, heart failure patients for 2 years took 100 milligrams of it 3 times a day compared to placebo. They had a 44% reduction in cardiovascular mortality, 42% reduction in all-cause mortality. That is absolutely huge. 45% reduction in hospital visits, 29% improvement in just heart function overall. So really the effect of CoQ10 on morbidity and mortality and chronic heart failure, I think the data speaks for itself. And that's why I think by now you probably have an idea of this is why I reached to CoQ10. It's one of my favorite antioxidants for a number of reasons. And aside, I mentioned, and so I glossed over this really quick, but I want to come back to it. So cardiac, but I also said, brain, right? So there's also data helping, and this is using dosing up to 1,200 milligrams a day for Parkinson's patients. Okay, helping to slow Parkinson's disease. Absolutely huge. Okay, so don't be afraid to slam it. There is no lethal dose we're afraid of. That we've learned of. So don't be afraid to crank that up, certainly if we need to, depending what you have going on. So ubiquinol, so this is really a reduced form of CoQ10. It's going to have an enhanced absorption over normal CoQ10. Very fat soluble, helps with all the different enzymatic processes, great antioxidant and cell stabilization. So that's our ubiquinol 100 milligrams. We also have that in a 60 count bottle. That's why I say 1+ per day, depending what you have going on. If it's just overall health, 1 a day. If you're on a statin, crank that up. If you've got congestive heart failure or that sort of thing, then, I'd hit it with at least 300 milligrams a day. Okay. Also, what they found out is when you add the omega-3 essential fatty acids and CoQ10 combined, that even helps further. So this is a study that looked at an omega-3 with CoQ10 and even combined with statin therapy. So basically significant reduction of hepatic enzyme activity, systolic blood pressure, inflammatory markers, TAG levels were detected in both groups in comparison to the control. So coenzyme Q10 addition significantly reduced most of the parameters studied, which was systolic blood pressure, total cholesterol, LDL, CRP, interleukin-6 in comparison with the statin plus omega-3 group by itself. So overall, the CoQ10 helped also decrease the adverse side effects of the statin. So great data. And again, fish oils, omega-3 essential fatty acids. Okay. Some other arsenals I have in my tool bag, pantothenic acid. So if you have elevated triglycerides, let's say your total cholesterol's a little elevated, LDL's not bad, HDL's not bad, but it's really your triglycerides and your total cholesterol that's through the roof. Bingo. I'm going to pull in our pantothenic acid. It's 500 milligrams. Do it 3 times a day with food. And of course, guess what my answer is? Plus our pure omega fish oil. Okay. And for that, I would do two times a day for the fish oil, right? And for the pantothenic acid, 1-3 times a day. Do take it with food. It's a B vitamin. It can upset the stomach if it's on an empty stomach. Berberine, I think that's a great alternative to the statins, as well as a variety of some of the other cholesterol lowering agents. So it does help lower total cholesterol, helps also lower LDL, helps against insulin resistance. It's also natural antibacterial. 1 capsule generally twice a day. Certainly I'll go lower, I'll go higher depending on what's going on with the patient. Red yeast rice. Now our red yeast rice plus, we call it plus because we also add NAC, milk thistle, as well as CoQ10 to it. Now it's got about 30 milligrams of CoQ10. I generally take that higher. Yet red yeast rice does serve as a natural statin. So it does serve as a very weak statin. It's not my first go-to. Honestly, my first go-to is going to be the berberine, because berberine's not going to have an impact on that mitochondria and decreasing your endogenous CoQ10 levels. But for those that really have been on a statin, or we've tried berberine or we've tried some other things and their cholesterol is just absolutely stubborn, then I'll do that, and I'll go anywhere from 1 to 4 capsules in divided dosing. Again, depending what your labs are and where you are. As with most things, with cholesterol, if they put you on a medication, they're going to put you on it and say, let's repeat the labs in 3 months. The same is true for natural agents, right? And of course, what I've already spoken about with regard to the diet, Mediterranean style diet, is clinically shown to decrease cholesterol. Also, pulling in that exercise, that's also going to further help to lower the cholesterol and help lower blood pressure. And segue to blood pressure support, right? So this is a combination of magnesium, has some hawthorn, some coleus friscoli in it, taurine, as well as hops. So a great multi-combination formula for the blood pressure, typically 3 tablets a day. Does well to help kind of pull down that diastolic and systolic. Vitamin K2. So you'll notice vitamin K2 is built into our vitamin D3. We also have vitamin D3 by itself, but it costs so little. It's like maybe $1 more to have it with the K2 in it. So why not? It's a 2-for-1-er. But what that's going to help with is hardening of the arteries, right? Otherwise known as atherosclerosis. Vitamin K2 is also going to help get the calcium into the bones. It's going to help with the absorption of the D3. But the big thing for today here is it's going to help against that hardening. So, 75 mics of that 1 to 2 a day. Niacin, niacin's an oldie but goodie. Helps reverse B3 deficiency. It's a precursor to NAD and NADP. Helps inhibit tryptophan and pyrrolase involved in brain function. Helps with lipid levels. It may cause flushing, and that's why this one is a patented sustained release formulation. It does extremely well for that. So it's going to minimize that flushing, but still take it with food. Right? Anywhere from 1 to 2 a day. For some patients, I will go higher than that, but honestly, most of my patients going 1 twice a day will tend to do the trick. So also niacin can spill over and help some with blood sugar too. So that's kind of a lot of the tool bags in the tools as far as overall for a variety from triglycerides, blood pressure, cholesterol overall. Now getting into, well, let's talk about nitric oxide. And I think nitric oxide, I kind of separated this a little bit because that's how important I really think that really can make on cardiovascular function. So the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. That was from Dr. Valentin Fuster back in 1998. He was the president of the American Heart Association. Pretty big statement. Okay, so let's get into some of the science and the whys. If all arteries, veins, capillaries of the human circulatory system were laid end to end, the total length would be 60,000 miles or about 100,000 kilometers. That's 2.5 times around the Earth. It's a lot. That's a lot of circulatory system, folks. So as we age, we lose 85% of our ability to make nitric oxide. So it's progression of the endothelial dysfunction. So you can see this is age here, and this is decline in nitric oxide. And again, this kind of goes, it's interesting, right? You'll see this 30, 35, things dropping off, okay? So that's where levels start dropping off. That's where we really need to kind of start paying attention to things. And you can see as you have that increase / decrease of nitric oxide, you can see things starting to happen. So, as you start getting down to 80% of what you were, thickening of the arteries, half inflammation, plaque buildup, then you get down to 35% load, stiffening wall and that calcium buildup, and then 15% of where you were, rupture, possible heart attack, right? Look at that narrowing in the opening versus here, being able to send that blood through. Nitric oxide plays a role in nearly every physiological process in the body. So from cardiovascular function and homeostasis, sexual function and hormone production, both male and female. So, hey guys, you got ED, think nitric oxide, right? Females, I'm not having the orgasm I used to. Nitric oxide, right? It's going to help with blood flow. We need blood flow to those areas to help with that sensation and fun. So, maybe we should have had this before Valentine's Day, but, we would have had to have it a little bit. So at least we're getting you ready for next Valentine's Day. Then hopefully we can knock the sheets off a little bit for you. Neuropathy, diabetes, cognitive function, neurogenesis, exercise performance and recovery. So yes, my high performance athletes, we want to make sure we're optimizing nitric oxide function. Gastric function, stem cell treatments, and hyperbarics, right? We want to help with that oxygenation. So, certainly what we're seeing overall in our office is high blood pressure, low stamina, GI issues, muscle pains, hurt, burning, tingling, numbness in the chest, pain, swelling, cold hands, feet, toes, history of NSAID use, a non-steroidal anti-inflammatory. What's that? That's your Advils, right? That's your ibuprofens, your Motrins, your ketoprofens, diclofenacs, erectile dysfunction or low libido, irregulation in hormone function, and genetic SNPs, including that MTHFR. So again, MTHFR, that methylation issue, that can be a real mother, and that can certainly affect nitric oxide function and formation as well. So again, all patients over the age of 40 are low in nitric oxide. The question is, how low are you, and what difference is it making? So how we can do it, we can actually test this. It's easy. You come into the pharmacy, we can test it right there. You can take it home. Here you basically, you put the strip on your tongue, then you fold it in half and hold it together for about 10 to 15 seconds, and it gives you a color. You hold that color up to the side of the box, which here, this is larger for you. So this kind of tells you where your level are. So if you're a nice, bright, vivid pink, hey, that's great, fantastic. Maybe we can back off a little bit. Target's right here, nice, lovely pink. And then as that kind of gets more of a lighter shade of pink, that's showing that you're depleted. So easy to monitor. And I mean, you can go and actually supplement and then retest in a couple of days and go, ooh, wow, wait a second. I'm moving that needle over. So how cool is it? We can actually follow it and see what we're doing is making a difference in helping with that pathway, right? So, we can use arginine for that pathway. Arginine is not as effective, or L-citrulline. Those are two things that are commonly used to help kind of push that piece around a little bit. But certainly there's other ways that we can do to help that are more efficient, if you will. So blood flow to tissues is actually more important in most circumstances than how much oxygen is carried by hemoglobin. The respiratory cycle is actually a 3-gas system. So that's some things that we want to look at. So the problem is there again, cardiovascular disease, 1 in every 4 deaths, 610,000 die of heart disease every year. Every 42 seconds, someone has a heart attack. Each minute, someone dies from a heart disease related event. That's huge, folks. Now, I know those of you on today are more proactive, right? Hey, I want to do something. But maybe it's not for you. Maybe it's for a loved one. So the amount of people dying from cardiovascular disease is equivalent to 4 jumbo jets crashing and killing everyone on board every single hour, every single day, each year. Kind of depressing thought, I know, but to kind of put it in perspective, right? So we really want to think about that dietary nitrate and nitrite intake. That's going to mix with our commensal bacteria that can reduce 20% of that load. Low gastric pH can also reduce that nitrite to nitric oxide conversion. And then certainly getting that absorption from the gut. So if we have GI issues, that can affect it. And then, of course, getting that systemic absorption, getting it filtered through the renal system, then end up with maybe 25% circulating nitrite concentrate in the saliva gland. So there's other things along the way, certainly, that are impacting that. So how much do we need? About 300 to 400 milligrams of nitrate is necessary to see changes in the blood pressure or improvement in exercise capacity. So it's estimated that population consumes about 150 milligrams per day over 2 to 3 meals. So right from the get-go, right, we're not getting enough in our diet to hit what our need is. So we're deficient from the get-go. And that's why we see that catching up to us in the 30s and definitely by the time we hit 40. So things that can disrupt that production, antiseptic mouthwash. So one option, could be stop using mouthwash. Now I know that can be catch-22. If we got some dentists on today, go, oh, wait a second, Baylor. Yeah, right. Everybody has to assess what's going on. Antacids, stop using antacids, especially those proton pump inhibitors. Let's get to what's going on. Why are you having GI issues? Why are you having reflux? Are you pooping every day?
Sorry, you kind of froze there for a second, but I think you're back on now.
Okay. All right. Thank you. Stop eating high carb meals and highly processed junk food. High glucose causes glycation of the enzyme that makes nitric oxide and stops it from working. Things that help promote or restore the nitric oxide production: healthy, balanced diet with lots of green vegetables, moderate exercise, infrared light therapy or infrared sauna, safe and effective nitric oxide supplementation, right? So, and this we spoke about already. You should be doing this anyway, right? For your overall health. Nitric oxide inhibits the replication cycle of severe acute respiratory syndrome. So here's a study that looked at nitric oxide in COVID. Right? Pretty interesting. It inhibits the SARS replication. Just figured I'd do that as an aside since we're still seeing COVID, and I think COVID's going to be around. It's just going to be part of our existence from here on out. So some conclusions about nitric oxide. Nitric oxide controls and regulates the blood flow and oxygen delivery to every cell in the body. There's certainly an age-related decline in production that asserts its effect on the cardiovascular system and risk for other chronic disease. Diet and exercise are not always sufficient for restoring that. As I said, diet, generally about 150 or so milligrams, and our need is at 300 to 400. So we need twice of what we're eating. Again, I started off by starting with, hey, we're fat. So many of us are overweight. We need to lose the fat mass. So the answer is not, hey, let me eat more, right? Ultimately, part of that equation would be, let's get more nutrient-rich soil. But that's a story for another day. Strategies to restore nitric oxide production and homeostasis will have a profound impact on public health in the future of medicine in general, but we must use safe and effective nitric oxide technology to optimize that piece. So what we've got here, Berkeley Life makes a fantastic nitric oxide formulation. 2 capsules a day, take it with food. As you can see, we've got some vitamin C in here, thiamine, B12, and it is the methylated B12, some magnesium, potassium, and then a blend of some beetroot and nitrate, potassium nitrate, to really kind of take that to where we want it to go. So let's test it, see where you are, replace it, retest it, and you can verify, wow, I'm making a difference. Of course, then you'll also see the difference, hopefully, in the sheets and your performance in general with everyday health, and just be feeling better. And of course, going back to the narrowing of the arteries, and hopefully we can be trying to avoid that as well. So hopefully that made sense. Now, I want to spend just a few minutes on CBD, just because of its really role with here. So certainly it's responsible for homeostasis in a variety of different areas, heart, etc., our reproductive organs. This is by Raphael Mechoulam. He's a chemist who identified the endocannabinoid system. He has said, I can't list all the physiological systems and conditions affected by cannabinoids because there are too many. That's huge. World Health Organization on CBD. CBD is safe and well tolerated in humans. It's not associated with negative public health effects, not associated with abuse potential. This is from the World Health Organization, folks. So those of you that may say, well, I haven't wanted to do CBD because I'm scared of it, or, no. There's lots of data on CBD. Now, why I'm wanted to really point this out from a perspective for cardiovascular, again, inflammation, right? Inflammation, anti-ischemic, vasorelactant, neuroprotectant, anti-proliferative, lots of different reasons for taking it for the cardiovascular system. There are over about 115 different cannabinoids. So typically we're going to be using a variety of cannabinoids so we can get that entourage effect. It's not just CBD. We kind of refer to CBD for cannabinoids, but actually CBD is a specific cannabinoid. There's CBDG, CBDN, or CBN, CBG, CBC, CBDA, the list goes on, right? So using a variety, really having that synergistic effect. Dosing wise, I love tinctures. I use tinctures. And the reason why I kind of start with tinctures is the most cost-effective way to do it. So if we can save you money, that's what I want to do. So generally, I'm going to start with our 900 milligram Boxley's bottle, which is 30 milligrams per ml. Start with a third of a dropper full for 5 days, and then go to twice a day, and then increase it again. Basically, we keep increasing the dose until we hit your desired impact, or if you get daytime sleepiness, we back off the dose. Again, most of my patients are somewhere between that 30 to 50 milligram. If you've had a recent injury or something like that, or post-surgical, then, I'm going to increase that up to at least 60 milligrams, 80 milligrams, maybe even 100 milligrams. We do have gummies available, soft gel. So again, if it's, hey, Baylor, I don't want to deal with a tincture, great. Gummies taste fantastic. It's a strawberry lemonade, or soft gels, bam, put it in your medicine thing and just be done with it. Also topically, for aches and pains, that sort of thing, we've got creams and salves that work fantastic. And certainly what's good for us is good for our pets. Side note, what's one of the main killers for canines? Congestive heart failure. CBD is good for the cardiovascular system, good for the pets, also helps with anxiety for the pets, separation anxiety, thunderstorms, that sort of thing. Quality, not just CBD, but also quality of supplements. I mentioned this earlier. So we're very picky about who we deal with and why. So summation, to bring back to baseline, again, phytonutrient multi, it's bringing in the essential vitamins and minerals. 2 of those equal, it has what's called an ORAC value of about 9,000. So that's like eating the nutrient density from 9 fresh fruits and veggies a day. I'm not saying that should replace the fruits and veggies, but we're not getting the nutrients out of the fruits and veggies we used to be able to get years and years ago. And of course, the methylation, right? Fish oils, vitamin D with, again, especially in today's conversation, K2 for the heart and helping against atherosclerosis. CBD, and of course, you guys probably realized the nitric oxide formulation by Berkeley Life, right? That's kind of here, if we're, let's say, 35 years old and over, then really, honestly, that ought to be on the baseline as well. 2 capsules a day with some food. So I know we've gone over a lot of information really pretty fast this afternoon. Certainly, if you want to look more in depth at any of these, we do have a CBD webinar that we've spent just an hour talking about CBD alone. That's on the YouTube channel. We've got weight loss webinars up there. We've got a whole variety of things. Next month, March 15th, 2 p.m. is our GI health webinar. So we'll be talking about the gut and what we can do for that. So let me pull up to see our Q&A with what we've got. So folks, you should have in your little thing, either at the top of the screen or the bottom of the screen, depending how you have your screen set up, should be something called Q&A. So you can click that and type in questions there. I'll also check the chat, make sure no one typed in there as well, but the Q&A is the best. Yeah, no, so I don't have anything in the chat. So type your questions in the Q&A for us and we'll get those answered. In the meantime, you may be thinking, okay, well, how do I get started here? Start on the baseline supplements, right? You've got the list right there. You can stop by one of, if you've got one of the Revelation pharmacies close to you, stop by your local one. They can help you. Or if I don't have somebody close by, then certainly go online, click shop now. We can ship it right to you. It doesn't take hardly anything to hit free shipping. I think it's $50 or more and we have free shipping. If you want to schedule a consultation, then email patient care at RevCustomRx. Allison is our patient care coordinator. She can get you scheduled. She'll get questionnaires sent to you. It's about a 6-page form that you'll fill out, get any of your recent labs you've had done and get that scheduled. We had a question come in. Do you need a consultation to buy the supplements? No, you don't. You can just stop in one of the stores or go online and order it and take care of it. Where the consults come in are, Baylor, I need help. I'm overwhelmed, or I've got a specific issue going on. So, and then that's where we can take it and do a very patient-specific protocol for you. The first thing I tell every patient is, you're the boss, you're in charge. It's your health. We're here to help educate you, help guide you, get you to where you want to be. How much K2 should you take a day? Really a minimum of 75 micrograms to 150 micrograms, depending, if you've got some atherosclerosis, and I'm going to take that up about, 150. If we're just looking at for just general replacement, then around 75 micrograms per day. All right, guys, I'm waiting. Any other questions that we have this afternoon? I'll give it a couple more minutes for you to type in any questions you have. And of course, if you've got a local one of the Revelation partners near you, you've got an educated staff. You've got some great people right there that are there to help you with questions, help answer. I'll also, while I'm waiting for you to type in any other questions. One thing I didn't hit today that really I could have added, and I could keep going on and on and on, but I kind of hit today as, what are my top picks for cardiovascular health, and where is, my typical fast go-tos. One other thing here that I didn't have is BHRT. Okay. BHRT, bioidentical hormone replacement therapy for men and women. What's it going to do for women? Cardiovascular, bones, colon, brain. For men, very similar. Having proper hormonal balance is going to help with protection from cardiovascular disease. I'm going to go back to this. Hello, come on. Where we had quality of life and quality of life dropping off at that 35. What can you also parallel with that? You can parallel hormonal levels, right? Again, we want to keep things up. Another question came in: since many of the supplements have duplicate inclusions, is the best way to identify which ones to take through a consult? That's always going to be your most in-depth and the most customized. Absolutely. But, multi-fish oil, vitamin D, CBD, nitric oxide, there's going to be a little duplication with what's in the nitric oxide formula with what's in the multi, but that is intended that way. That's built to go on top of the multi. So those 5 things, we really aren't going to have duplication. Where that's going to come in is if you're on a bunch of things already and, okay, how do I weed through this? I'll do that all the time. People coming in, or if it's Zoom, send me the list of everything they're on, and we'll kind of go through and optimize. I try to keep things as much as I can to 5 or less. But as you can see with this right here, we're at 5, right? So that is right there where you're at it. A question came in for the nitric oxide test. Oh Lord, hopefully I don't get this wrong. Don't hold me to this, but I think a tube, I think it has 50 test strips in it. I want to say it's $39.99. And for the capsules, I want to say it's in the $40 range. So, you're looking at $40 for the test strips, and you got 50 in there. That's going to last you a long time, because you're going to do it up front, right? You're going to take it for a couple of days and then do it again. And then maybe do it for the first couple of weeks and notice your level going up. And then once you notice, wow, my level is great, then you're only going to do it every so often. So it's not like you're going to be buying the test strips every single month. That's going to be initially, then every so often. But, I'm a scientist. I'm a compounding pharmacist. So I like data. So I think it's cool anytime we can follow data and look at that. And certainly going back to the hormones, what do I like to see there? I like to see data. I like to see the labs where you are hormonally. And certainly if you have more questions with that, we do have webinars up on the channel for both men as well as women. And then you can also always email Allison at Patient Care, and she can let you know what labs we like to see, so you can have those drawn. All right, folks. Well, I don't see any other questions in there today. If you've got anything else, pop it in there real quick while I wrap up. I do want to thank you for your attention. Thank you for joining us. If you would, give us a like on the variety of the social channels. Give us a review. Hopefully you feel like you learned a lot today. If you did, then I accomplished what I wanted to today, is hopefully also, teach you something, open your mind up, and let you know options are available. We can look at things a little bit differently. I did have one last question here I'll take real quick. I've been taking a statin for you. I'm reading this for the first time as I'm reading it. So I've been taking a statin for years, and I deal with overall joint pain most days along with fatigue. I thank you for talking about the CoQ10 supplement. It's just shocking that my physician never mentioned this. I hope to schedule very soon to meet you. Thank you. Oh, I'm sorry, that's not a question, but thank you. That's very kind. I appreciate it. So you're very welcome. It's my honor to be here with you today. What's interesting, I'll share a tidbit. So the early information on CoQ10 and statin use, anybody guess what company figured that out? Merck Drug Company, that started with Mevacor, one of the first statins. What did they do with that information? This is going to make you mad. You didn't put your name in here. It came through as anonymous, but it's going to piss you off. They sold that information to the Japanese, right? And where does a really good CoQ10 come from? The Japanese. You know, they figured this shit out years ago and really have worked on helping with absorption and that sort of thing. So we use Kineca, ubiquinol. And so, yeah, they sold it off. What should they have done, in my opinion, is they should have put CoQ10 in with the statin. That would have helped patients. So anyway, no, I appreciate that and appreciate everybody today. Thank you so much. I hope you all have a fantastic day and even better rest of the month. Thank you, and see you next month. Again, GI Health next month on March 15th at 2 p.m. See you there. Bye-bye.